I am Jennifer Erausquin, and I am here today for my Global Health Exchange talk. And the way that I've set this up is that I do have a PowerPoint and I do have slides for the beginning part of my talk. And I have many fewer slides for the end part of the talk, which is where I want your feedback. And so I do want this to be a discussion rather than a lecture of some sort. But I will be talking a lot more, especially in the beginning part of the presentation. So, any questions before we get started? Okay. Let's see if all of our equipment.
Jennifer, can you just write a little bit about your background? Like, who are you?
Hi. I am a postdoctoral fellow in the Global Health Institute here. I work with Kim Blankenship on Project Prevalence. And as you'll see today, I also do some work in the Dominican Republic. My PhD is in public health from UCLA, and I've been here in Durham since July. So that's kind of the basics. Alrighty. So today, first I'll give an overview of the research that I've already completed in the Dominican Republic. I'll talk about my new project, which is a mixed method study of community effects on women and HIV in the Dominican Republic. And specifically, today I'm focusing on the quantitative portion of the mixed method study. And I'll talk about the data sources. I have some questions and looking for feedback in terms of data access and compatibility. And I'm also looking for people's tips if you know of any resources, and we'll get to that, but on GIS software and analysis. So I started doing research in the Dominican Republic in about 2007, research focusing on women's vulnerability to HIV, and I focused primarily on increasing understanding of women's HIV knowledge and behaviors, and the role of both individual and community characteristics in determining them. And I'll start you off with a bit of a background. The Caribbean has the highest regional HIV prevalence outside of sub-Saharan Africa. It's about 1.1%. 25% of the 25% of all people living with HIV in the Caribbean live in the Dominican Republic, and that's almost 70,000 people. For the past decade, HIV has been a leading cause of death for women of reproductive ages. And behavioral surveillance is indicating that there are some risky behaviors that are increasing. Age at sexual debut is decreasing, and behaviors such as having 2 or more partners in a year and having high-risk sexual partners is increasing, particularly among young people. So they're having a longer duration of sexual activity over a lifetime and having greater high-risk behaviors. Yeah.
So you said so the age of sexual debut is increasing. So what is about the average?
About 17.
Wow. So it's still not 17. Yeah.
And of course, that's
quite a bunch of fruits.
But that's based on, and I can show you where it's coming from, but that's based on a survey of 15 to 49-year-olds, and done in a household survey that is intended to be as private as possible with each respondent, but may not be the ideal way of collecting some kinds of sensitive information, particularly among young people.
So do you think it's possible that there could be, of course there are going to be people younger than that, do you think it's possible that maybe that's underreported because I'm guessing the social mores about, people, young people, exactly people respond that way. I mean, I'm just asking.
So I don't know how accurate the 17 as the age of sexual debut is, but I'm fairly confident because the same method has been used over time that the trend of a declining age at sexual debut, I have faith in that trend.
So with the declining age of sexual debut and this sort of evidence of increase in high-risk behaviors, is there also a corresponding increase in HIV prevalence among this population, or is it remaining pretty steady?
Among general population women, HIV is increasing. It's stabilized among certain population groups, sex workers, and specifically in the Dominican Republic, sex workers are held up as an example of look at the great HIV interventions that we've done, and this is the positive results that we've seen. But the results have not been that positive in general population women. That's a good question. So the increasing burden of HIV among women in the Dominican Republic, I think, is highlighting some of the limitations of individual-focused HIV prevention efforts, and those primarily have been methods focusing on abstinence, be faithful, and condom use, that whole message. And not just in the Dominican Republic, but in other places around the world as well, attention has turned to the potential role of social and economic contexts in which people live as influencing their vulnerability to HIV. And a particular focus has been the social context of communities, or the people and institutions with which you interact on a daily basis. However, there's few empirical studies that appropriately link both individual and context with individual HIV-related outcomes.